Welcome back to the deep dive. You know World Cancer Day is coming up, and, well, it feels like it's time for us to kind of dive into a topic that affects all of us in some way, cancer. And Tara, you've given us a great starting point with this material from the World Health Organization's Eastern Mediterranean Regional Office, WHOEMR for short. I don't know about you, but I always find it so interesting to look at global issues through the lens of specific regions. And the Eastern Mediterranean region offers a really unique viewpoint when we're talking about cancer.
It's really about understanding the nuances, those particular cultural contexts to make a real impact. What's striking is how the WHO EMRO takes this global issue like cancer, but tailors its approach to the specific needs and challenges and opportunities within this region.
Yeah, you hit the nail on the head. One of the first things that jumped out at me in these materials was this focus on how lifestyle changes are driving rising cancer rates. We're talking about the rise in processed foods, people having more sedentary lifestyles, and of course the whole tobacco epidemic. It really highlights how these issues go beyond borders.
Yeah, and it's not about pointing fingers or placing blame. But what's crucial is that the WHO EMRO doesn't just throw these statistics out there to scare us, They actually couple it with this really powerful message of hope. Did you realize that they estimate something like 40% of cancers could be preventable and another 40% are treatable? With early detection and treatment, that's huge.
It really is. And this is what I found really fascinating. They get into these cost-effective ways to address the cancer burden. And we're not talking about some distant futuristic technology. It's about promoting those healthy lifestyles we were just talking about and getting serious about tobacco control. It's a good reminder that sometimes the most impactful solutions are the ones that are right in front of us.
Absolutely. It's about giving people the information and the tools they need to be in charge of their own health. And this is where the work of the WHO EMRO in the Eastern Mediterranean region is really impressive. They're doing essential work training healthcare workers, especially in palliative care, which is so important for improving the quality of life for people living with cancer.
I was really drawn to their focus on breast cancer. It's a huge concern in the region, and they're really tackling it head on. They have these multi-pronged approaches, training healthcare providers on the most up-to-date diagnostic tools and treatment methods. At the same time, they're working to raise awareness in the community about early detection and the importance of screenings.
And it's more than just throwing information at the problem. The WHO EMR is really invested in building capacity in the region, training healthcare professionals, improving local infrastructure, and empowering communities to take charge of their own well-being. It's about creating lasting change.
As I was going through all this, one thing that really struck me was the WHO EMRO really emphasizes the economic side of cancer. It's not just a personal tragedy. It's a huge burden on economies, especially in low and middle income countries.
Oh, absolutely. And that's where their argument for investing in prevention and control is really powerful. It's not just the right thing to do for public health, but it makes sense economically, too.
So it's like a win-win. You protect people's health and you take pressure off the healthcare system.
Exactly. And the evidence is there. Like they point out that investing in tobacco control, it not only reduces those cancer rates later on, but it saves a lot of money in healthcare costs. It's being proactive instead of reactive.
Yeah, it seems like this whole idea of prevention over cure, that's a big part of their approach. It's about tackling all these different risk factors right from the start.
It really is. They go beyond just individual lifestyle choices. And they talk about what are called social determinants of health, things like poverty or access to education. They say these things can really impact someone's risk of getting cancer.
Yeah, that makes sense. If you're worried about where your next meal is coming from, or you don't have good health care, making healthy choices isn't always going to be the first thing on your mind.
Exactly. It's about making sure everyone has a fair shot at being healthy. And to do that, you need good data.
And speaking of data, I was impressed by how committed the WHO EMRO is to using data to actually shape their strategies. They talk about cancer registries and how important those are for understanding cancer trends and then actually making effective control measures.
Yeah, those registries, they're basically systems for collecting and analyzing data on cancer cases in the region. It's like having this detailed map of cancer so they can see where resources are needed most and track how effective different things are. And they can really push for changes based on what the data shows.
So it's not just about the numbers themselves. It's about using those numbers to make a real difference.
Exactly. For example, they're using this data to push for stricter tobacco control, advocate for healthier food environments, and improve access to screening and treatment, all based on what they're seeing in the data.
That's great to see, that kind of commitment to actually using evidence.
Yeah.
And on a slightly different note, I noticed they're also really interested in technology. particularly health or
Mm.
mobile health.
Right. It's amazing how technology can change healthcare, especially in places where it's hard to get to a doctor.
Yeah.
Imagine reaching people in remote areas with really important information about cancer, or connecting patients with specialists around the world, all for their phones.
That could be huge. It feels like technology could really help close those gaps.
Absolutely. And the WHO EMRO is really looking into how to use things like mobile apps and digital platforms for everything from raising awareness
Yeah,
to supporting cancer patients remotely. It's about bringing healthcare into the modern world.
absolutely. And talking about the specific challenges in the region, the materials also mention the political instability and conflict that sadly affects a lot of the Eastern Mediterranean. And it made me think about how difficult that must make it to prioritize something like healthcare, let alone a complex issue like cancer.
It's a difficult reality.
Go ahead.
Conflict and displacement can disrupt healthcare systems and make it hard to get essential medicines. And when your basic needs aren't met, it's hard to focus on health.
It is. But I was really encouraged that the WHO EMRO doesn't shy away from these issues. They're working to strengthen healthcare systems even in those tough situations and advocating for more humanitarian aid to help cancer patients in those areas.
That's right. They're committed to helping everyone, no matter what.
It's clear the WHO EMRO is right there on the front lines fighting cancer in the Eastern Mediterranean, but even they admit they can't do it alone.
Exactly. They're calling for a team effort. Governments, organizations, individuals, everyone needs to work together. We all have a role to play in reducing the impact of cancer.
I noticed they really highlighted community involvement, the idea that when communities take charge of their own health, that's what makes a real difference in the long run.
Right, and they point to these community programs that are doing really innovative work, like peer-to-peer education, mobile screening units that can reach people in remote areas, even support groups for patients and families.
It's about going where people are
Yeah,
and finding solutions that really fit with their culture and their needs.
exactly. And it all comes down to knowledge is power. When people understand the risks, how to prevent cancer, and their treatment options, they can make the best choices for themselves.
It's about taking control, being your own advocate. And it's not just the physical side of it either. The WHO EMRO talks about the emotional and psychological impact too, on patients and their families.
Absolutely. They stress how important it is to have that emotional support along with the medical treatment, making palliative care part of the plan from the beginning, ensuring people have access to things like pain management, emotional support, even spiritual guidance if they need it. It's about caring for the whole person, not just the disease.
It's a good reminder that a cancer diagnosis affects everything,
It does.
and we need to provide support on every level.
Couldn't agree more. And while the WHO EMRO focuses on the Eastern Mediterranean, their work has implications for everyone. The things they're dealing with, the opportunities they see, it goes beyond just one region.
You're right. It really highlights how cancer is a global problem, and it needs a global solution. We need to be sharing knowledge and resources and learning from each other.
Absolutely. We need that global collaboration, research, and innovation. If we can support each other, learn from each other, we can create a future where cancer isn't this threat to our collective well-being.
Well, this deep dive has certainly given us a lot to consider. It's been amazing to look at the latest in cancer prevention and treatment, and to see organizations like the WHO EMRO working so hard to fight this disease.
It's always evolving, but it is inspiring to see the dedication and innovation out there.
It leaves me with a sense of hope because we're not powerless. We have knowledge, we have tools, and more it seems like we have that will to make a difference. So as we wrap up here, we want to hear from you. What really stood out to you? What will you take away from this look at cancer research and global health? How will you use what you've learned to make a difference? Because even those small actions, when enough people take them, can create a wave of positive change.